Hello, everyone. This is Stephen Wellman with HIMSS TV. I'm here today with Frederik Brabant, Vice President, International Healthcare Operations, Nuance Communications. Frederik, thank you for joining us on HIMSS TV. Can you describe what Nuance delivers for European healthcare?
Nuance is a global company that delivers AI solutions for speech recognition. Those solutions run out of the cloud, and the goal is to support doctors in getting clinical documentation done. You might have heard of a product called Dragon Medical, which is used with more than 500,000 doctors around the world. And that's one of those examples of products that help supporting the physicians.
Why is clinical documentation such a burden for clinicians today?
Clinical documentation has changed a lot in the last 10, 15 years. Initially, everything was on paper. Doctors were making paper notes, and all of that has, as we know, has become digital. The electronic healthcare records are there. And with the success of that and the benefits, sharing information, more clarity, very much with new technologies, while it solves a problem, it creates new problems. So doctors today spend much more time in front of a computer than they ever did before. And that goes up year after year. It's almost up to 3-4 hours a day that doctors spend in front of a PC editing medical notes or prescribing a wheelchair, prescribing medications and all of that. That leads to burnout. Doctors hate it. And that's why clinical documentation has become a necessity, but something which is a real burden. And that's where we as Nuance try to help in reducing that pain and preventing the burnout.
Great. Can you give us some examples of Dragon Medical customers in Europe and what they've achieved?
Sure. So there are actually many, as I said, more than 500,000 worldwide are using this product. And they use it for all kinds of different reasons to their benefit. Let me just name a couple. Antwerp University in Belgium, they are rolling out the deployment of Cerner, their electronic healthcare record system. And to align with the adoption of the doctors, to make it easier for doctors to use the Cerner product, they added speech recognition to it. It makes it possible for the doctors to navigate fast in their EHR. And actually, instead of to type in an EHR, they can just use the voice natural speech, and then the text is entered there. And let me give a second example. Oxford University Hospital in the United Kingdom, they did choose Dragon for cost reduction. They were outsourcing a lot of their documentation to India, and actually by implementing Dragon, they could actually reduce those costs significantly. And on top of that, they created a fast report turnaround time. So the medical reports were much faster available within days versus weeks previously.
How important is AI in the future of product development?
AI will make a difference in the future. We have seen already the first steps in the last couple of years, and it will only continue. And it is a combination of not only AI, but AI and cloud computing. AI has been used in speech recognition, and the moment that was done, the accuracy of the products went up significantly. And it is a combination of, first of all, cloud computing power. There's just access to much more processing power. When you go to AI, you need that, but with cloud you can offer that. And that combined with updates that can happen all the time, that makes a difference. Secondly, while AI has focused currently on speech recognition, AI now tries to, in the medical world, understand the medical language. So not only can we listen to the doctor and hear what he's saying, but can we really, what is in the text, what is the meaning of the report that is dictated? And the moment you get into that space, then you open a whole range of possibilities to do medical coding like ICD-10 coding or billing codes or SNOMED codes, clinical decision support. You can start working with virtual assistants by understanding the language. And we have set the first steps within Nuance already in that space, but more and more will come. We announced a partnership both with Cerner, both with Epic, around those technologies. and more will come.
What are some of the benefits of using speech recognition in the cloud, Frederik?
The cloud makes a really difference on two levels. Number one, the quality of the speech recognition is just better. There is much more processing power in the cloud, and all of that together combined with the AI technology gives a much higher accuracy, and the result on the screen is much better for the doctor. That's one. Secondly, it is at a lower cost. In the past, hospitals needed to invest in 5 or 10 speech recognition servers, hardware on site, air conditioning, electricity. They don't need to take care of all of that, so it's all done in the cloud. And the IT staff can focus on really on the application layer and helping doctors, and not anymore on, they don't need to focus on maintaining air conditioning machines. So that makes a real difference.
What would you say is the level of awareness of cloud security and cloud security issues in the EU?
In Europe, security, privacy is super important, and each of the country member states take that very serious, and so does Nuance. Nuance therefore invested in a whole set of local cloud infrastructure together with Microsoft Azure in Europe. So we only host locally in Europe for the European customers. And we meet the highest levels of security and privacy standards to do that, because we're treating medical data, and that is essential. So respecting European or country-specific or even regional or hospital-specific requirements on security, privacy is really important, and we spend a lot of time in doing that. And that's a focus. Yeah.
What is the future for clinical documentation?
We in Nuance, we believe that the clinic room of the future, the consultation room of the future will change. The way that doctors and patients interact today using a stethoscope and current tools will be different in the future. We see this evolving into a kind of smart room where actually there are the tools and microphones listening to what the doctor-patient conversation and trying to help in that, all very much respecting privacy and data security. So what does that exactly mean? Well, we're working on solutions that actually can not only report a dictated text by a doctor, but understand that a conversation, a full conversation between a doctor, a nurse, and a patient is sitting there, a 6-year-old girl with a mother there, and all four are speaking, and somebody might be even crying. So can we actually understand that entire conversation and then absorb what makes sense and what is the report, and automatically create that report for the doctors? So that is actually how we see the text communication evolving and the reporting created. And once we do that, then you can actually link it to clinical decision support system, intelligent databases who can help with clinical pathways and all of that. So instead of going to the standard speech recognition that was somebody dictates, it's about conversational AI and creating a kind of ambient intelligence where the room listens and helps the doctor in their work. Like in the past, one day the stethoscope came there and the doctor didn't need to listen with his ear to the chest of the patient. More and more intelligent tools will help for patient care and move to the next level.
Frederik, how did Nuance as a company react to COVID-19?
COVID was a surprise to all of us, and we all saw it evolving and growing, and we didn't know where it would end when it started, and I don't think we know it today. So the first thing we did is actually try to guarantee the safety of our employees and our customers. We started working from home really fast, and make sure we transformed our business into a kind of virtually delivery organization. Our professional services team started giving training online to the doctors, doing deployments online, and that was received very, very well. And with that, we created a kind of safe environment where we could still help the hospitals, and we could actually have our employees keep on delivering those services.
Thank you so much for taking the time with us today, Frederik. We've been here today with Frederik Brabant, Vice President, International Healthcare Operations, Nuance Communications. This is Stephen Wellman with HIMSS TV. Thank you for watching.